Welcome back to my channel. I promised you guys that I would come back and do a review on my very first rotation, and it just so happened to be in family medicine. So here we go. So I didn't know what was really expected of me, being that this was my first rotation. I tried to study before I went. I tried to take quizzes, watch YouTube videos, you name it. And to be quite frankly, I don't think there's really any way you can really prepare for rotations after going through 18 months of didactic and labs and shadowing and classroom. I mean, they always say that the real learning begins your clinical year, and I have experienced that. So just diving right into it, my very first day I showed up 30 minutes early. It was in family medicine in a place in a little town in South Carolina called Darlington, which is like maybe 20 minutes away, give or take, on a good day from Florence. So I came 30 minutes early. I met the staff before I met him. When I came in, he was very pleasant. He took me out to lunch on my first day. He got to know me on more of a personal level. He is very funny. Good doctor. I'm not going to say his name because I don't know if I can. I don't want to get in trouble with my school and all that other stuff. But he's an awesome doctor, an awesome teacher. He's been practicing medicine for 30 years. And he's a great source to keep in my pocket and a great person. I'm glad I had the opportunity to learn from him. But anyway, so while I was there, most of our patients all had hypertension, renal failure, cervical intervertebral radiculopathy. They had arthritis somewhere in their body, hyperlipidemia, oh my goodness, allergic rhinitis, GERD, high blood pressure with renal failure, high blood pressure with heart failure, cardiomyopathy, and cardiovascular disease, and diabetes. Number one is diabetes to some extent. All of the patients were in the age bracket of like 30 to 93. I actually got a chance to see a 93-year-old. It was a very laid back environment. The patients were very sweet. They let me do anything I had to do. They were pretty easygoing. Some patients came in and they were a little bit more complex than others, which is to be expected in family practice. And when I say I did see a little bit of everything, I saw everything from like a nosebleed to removing an abscess from the head, draining a boil, doing an IND. I drew some blood. I gave a lot of flu shots. As you know, the flu is going around like crazy. In the past 2 weeks, we have seen at least close to 25 patients that has come through the office with the flu. Some mornings, that's all we did see was flu. And so, but anyway, what else did I see? We went over lab values. I learned a lot with the medications, because that was really one thing that I was really freaked out about, was pharmacology. In our program, I'm pretty sure it's going to change, but we get 1 hour of pharmacology a week. And so I was like, I remember some things, I remember the big things, but I don't know everything with pharmacology. I don't know all of the medicines. Oh my God, what am I going to do if he asks me a question about a medication and I can't really say? But I mean, I pieced it together. Of course, everything was brand name for the most part that we were prescribing to most of our patients. And I know generic names, which is a good thing because brands can change. And you know, companies buy out other companies and however that works. But I mean, I learned a lot and what the medications are used for. My doctor that I worked with and his PA printed out these sheets, which it gave you the patient's demographics, labs for the day, because most of them just did follow-up appointments, which were every 3 months. And they would have their labs done, chest x-ray, echo, EKG if they haven't had it, CBC, BNP, hemoglobin A1C, and a urine analysis done. And so I learned that pretty quick. I picked up on how things are ran, you know, the routine of the office pretty quick. I got along with the staff wonderfully. I mean, I couldn't ask for a better rotation. Now, granted, every rotation isn't the same for everybody, but I just looked up and it was awesome. Now, the PA that I shadowed the doctor. Well, not shadowed. I rotated, excuse me. I was on rotation. So I saw patients by myself in the mornings, and the doctor would come in and do all the medication part. That was every day from 8:30 to 12:30, depending on when we got through with our last patient. So lunch is usually 12:30 to 2 o'clock. I know, right? Nice, right? And I would get all my charting done and get me some lunch, whatever, etc. Then I would come back and I would shadow with the PA from 2 to 5. And so what he would normally see, he'll get a couple of new patients here and there, but mostly a younger generation of patients. The ones that probably work morning shift, or the, you know, the adults or whatever that probably work morning shift and can't get off in time to have a morning appointment, so they have an afternoon appointment. Occasionally, like I said, we'll get some new patients, but for the most part, it was either them or a walk-in that we would do, and most of them would be acute visits. Some would be very vague, like for the most part, a guy came in and he came in with symptoms that sound like anxiety, but we had no way to prove it. And you know, certain little situations like that, when people don't have insurance, it makes it very hard for you to try and figure out what to do with certain things. Oh, and one of the perks, I'm sorry, I'm all over the place, but one of the perks from my first rotation would be the drug reps. Drug reps came in and they brought lunch, but I call that dinner. Anytime you have collard greens, cornbread muffins, baked chicken, squash, and macaroni and cheese, and sweet tea, that's dinner, honey. That's dinner. But I loved it. So now I can get a little bit more organized. I just had to start off the video by telling y'all what I wanted to get off my chest, which was all the fun stuff that I did and how I experienced things and what did I do and how things were. So if you're about to go on your family medicine rotation, again, here's what you need to review: hypertension, chronic kidney failure, diabetes. Learn your insulins. Learn the side effects of your insulins. Learn about hyperlipidemia, a high intensity statin. When somebody is statin intolerant, they have a new medication called Repatha that they have changed their qualifications. So now patients who are statin intolerant can possibly go on Repatha. Look it up. What else? You should look up chronic rhinitis. Is fairly simple. Trying to think, what else did I see? I'm trying to remember what I just said a couple of minutes ago to you guys. Hold on, I'm having like a complete brain fart. A lot of hypertension, diabetes, hyperlipidemia, kidney failure. Allergic rhinitis. Oh, my cardiomyopathies and murmurs. Oh, good old cardiology. Make sure you know that too. Make sure you know your blood pressure medications. I think I already said that. But anyway, know that stuff. And if I missed anything from what I said previously, I apologize. Blame my brain, okay? I'm so tired. But review those things. Spend some time trying to make the connection between the pathophysiology and the patient. I know that might sound weird, but now that I'm in my clinical year, it's not just, oh, memorize this page. Oh, just have the basic understanding. It's my patient is, we drew some labs on my patient, got some blood work, we got a BMP. Their BUN creatinine ratio is high. Their GFR rate is very low. They're heading towards dialysis. On their diagnosis, their ICD code, it says hypertensive kidney failure. what does that mean, you know? And you have to go through making sure you know the RAS, or the renin angiotensinogen system, okay? Got to make sure you understand that. And then high blood pressure, that the high blood pressure constricts the vessels in the kidney, which causes them to think they're not getting enough blood flow. So they activate that RAS system, and that, you know, makes the blood pressure high, and it's this constant circle. I mean, you really have to connect the dots, and that's what I'm in the process of doing just after one rotation. I can honestly say that it's actually getting a chance to get up every morning, to go see patients and do what you're about to be doing in the next couple of months after you graduate and pass your boards. You get a preview of what you're going to be doing and kind of what it's like. And it's a wonderful experience, but this is when you learn the most, because now is the time to try and mess up. Now is the time to put your neck out there and step on faith and say, hey, I've never drawn blood before. Hey, you know, if you never had any patient experience before, I've never been in a room with another person that I don't know talking about what symptoms they're having, especially if it's sexual and medications. I'm not an experienced clinician. How do I do this? You step out on faith and you do it, because if you don't, and you don't take advantage of your rotations, when you graduate and you get out there and you get hired and you get a job, those employers are going to expect that you know what you're doing. And if you don't take advantage and mess up now, and I'm not saying you're not going to ever mess up after you mess up in rotations. We're humans. We're all going to make mistakes, but just do your best and try to get out your comfort zone on rotations and give it your all, because you'll be surprised at what you can accomplish when you do that. And if you fail the first time, I mean, I don't know about other PA programs, but our program gives us 4 weeks. So you can continue to perfect it the best you can and become proficient at it, at least to some degree, before you get out there on your own and start practicing. So I had a wonderful teacher, like I said. Even the nurses let me, I done did so many flu shots. I'm not afraid to stick anybody now, because that was one of my biggest fears. What if I get a needle and I stick somebody and I hurt them? What if I go too deep? What if I hit the bone? Da, da, da. I did none of that. It's like 1, 2, 3. Especially with the flu shot, I drew some blood. Patients were wonderful. They wished me the best of luck. They added me to their prayer list. And I must say, some of them were sweet, but I experienced the real side of being in the country for the first time in my life, because I'm originally from New Jersey. Shout out to Brick City. So I never heard of mixing kerosene with turpentine and chicken grease to dry out a wound. I mean, I heard a lot of things. The sky is gray, so my arthritis is acting up, you know, those type things. And it was hilarious. Learned a lot. But I just want to update you guys real quick on my book findings. So the PA there that I was rotating with, it's so hard to believe that I'm on rotations. I dreamed of this, guys. Okay, but he recommended this book. This book basically gets you ready to take your pants. It is full of questions and explanations. This whole book is divided up into sections like cardiology, hematology, dermatology, and it has questions and answers and explanations. And I think it comes with a website and a code that also lets you take practice tests on the computer to get you used to being timed and getting ready for the pants. This is another book called Step Up You Smile, Step 2 CK. So basically it's like Step Up to Medicine book, which I got that too. It's more condensed. It gives you the diagnosis, a little background and etiology on it, and then how to treat it and clinical presentation. So this was a good one. This is the Step Up to Medicine book I was telling you about. This book is awesome. I mean, when I have a little bit of extra time, I go through this, and it's very similar to this, so you don't have to buy both of them like I did, but awesome book to have. And then last but not least, this is a combination of all 3 books. I love this book. Sorry, you can see I got all my little papers sticking out, but I love this book. This is the book I've been using to prepare for my end of rotation exams, which you will have. I will say right now, moving on, from the books, the best way to prepare for your end of rotation exams is podcasts. It's one called the Physician Assistant Exam Review by Brian Wallace. I love it. If you have an iPhone or anything with a podcast, you get to a computer, type in physician, the Physician Assistant Exam Review.com. Check out Brian Wallace. He is awesome. Also, go to smartypants.com and you can take end of rotation exams, and you can look up Trust Me, I'm a PA end of rotation website, and it'll give you, depending on what rotation you're on, resources to prepare and charts and everything like that. Lastly, I have a journal, and I think everybody who goes on rotation should have one. And I just want to share some inserts with you from my journal. Okay. This one was from last Friday. It's Friday. We are on roller skates today. I met this patient and we had to talk about Jesus and big red trees and how the roots are shallow, but they connect to others, and through each other we can survive with help. He told me he knows I can do this, and he is praying for me too. Sweet guy. We had a nosebleed in the other room due to malpractice on an elderly patient. It stressed me out, reminded me why I started. I'm learning a lot. Said I'm going into my last week, going to get my doctor a cup, and I think he's going to like it. And the cup said Coca-Cola first, then I tell it like it is. That describes him 100%. My doctor, yes, he didn't care if he hurt your feelings. If you're not doing what you're supposed to do, he's going to come to you straightforward. He's a very straightforward guy, and he don't have time for BS. I loved him to death. And these three things right here, my iPad and my stethoscope, which is in my little holder, has been my life for the past 4 weeks. I know I kind of rushed through it. I know I was kind of quick because I think my camera is going to die soon. But if you have any questions that I didn't answer, please comment below. Please subscribe, and please hang tight to hear about where I'm going next, and look out for another video on that and another end of rotation review every 5 weeks. I wish you love, peace, and happiness. Until next time.
100% brown sugar.